Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender adult care. Welcome to my channel and welcome to weekly Q&A segment. For those of you who are not familiar, this is a segment I used to do where, and you probably came across a lot of those videos where viewers, a lot of you will send me your questions and I will randomly select some and go on camera and answer those questions. So I'm really excited. I actually cannot believe how excited I am. This is one of my favorite things to do. Now I wonder why the heck did I stop. I mean, I know it was a little too much for me in terms of everything else that I do, because I don't know how many of you know I am one woman show, meaning I do everything by myself. I don't have an assistant, I don't have a video editor, just everything I have to do by myself. And so sometimes as one woman person, between creating content and then also seeing individual clientele, it becomes too much. So now I'm in a place where I'm so excited to have it back. Very excited for the segment. Very grateful for all of you who voted on recent posts and let me know how much you missed it, how much you want the segment back. So without further ado, before we start, if you have a question for me and you would like to submit it to be featured on a segment, all you have to do is email me your questions. The email is down below. The email is also on my website. It's all over any kind of social media platform that I am on. All you got to do is email me your question. Please keep it between 1 to, I would say, 3 sentences. Keep it brief, keep it concise. If it is too long, I will email you back letting you know that you need to shorten it, because if question is too big, it becomes too much. It becomes too much to cover. Some questions are really more conducive for one-on-one work versus being answered here. So just keep it concise. That's all I asked. And you can send me more than one question. Somebody asked me this. You can send me as many as you want. There is no limit on the questions you can submit. Absolutely not. As always, I always block out any information, your name, your email, as I flash out the question on the screen for all of you to read. All of that information is private. So FYI, in case if you're concerned for privacy, that is all blocked out. I think that's pretty much all for housekeeping today. Let's get going. Some of you emailed me amazing questions already, just amazing. One of the questions on here is so common. So common. I'm surprised. I have not yet had a video actually covering this, because it is such a common thing. So let's get started. Question number 1. Is it possible to be just cross-dresser and not trans since early childhood? Could it be childish envy for things the other one has? The answer is, without a doubt, yes, absolutely. And I challenge a lot of you, when you have questions of this nature, to ask yourself, not if it's possible, but why wouldn't it be possible, right? Lead with that. Why wouldn't this be a possibility? So I know that a lot of people are feminizing, primarily feminizing, because I seldom see this with communities that masculinizes, feminize, and when they feminize, they experience connection to their sexuality, it leads to sexual arousal. And so there's a lot of people that wonder how much of it is just cross-dressing and how much of it is actually transgender identity. The simplest, and this very reductionistic way to look at it is to always go back to square one. Square one is going to be your relationship to your assigned gender. Generally speaking, people who cross-dress for beyond even, by the way, you can cross-dress for, there's so many reasons, not just sexual pleasure. You could cross-dress because you love feminine aesthetic. You could cross-dress because you love to put that persona inside of you to come out. Cross-dressing is an act of stepping into a relationship with clothing, makeup, accessories, shoes, just like anything else out there. You can say, for me, wearing particular looks, like you'll see me sometimes with my kind of more gauze silver jewelry, sometimes with more gold jewelry, sometimes with more heavier necklaces. All for me, this is a playful way to engage with aesthetic. So you can cross-dress for many reasons, not just sexual ones, by the way. So I just want to make it very, very clear. And people who just cross-dress, to be generally speaking, to make distinction between transgender identity, when you cross-dress, when a person cross-dresses, they engage in cross-dressing, which is a behavior, for whatever their personal reasons are. Again, it could be sexual, it could be because it feels good, it could be because it's creative, it could be because it's fun, it could be because it reduces stress. And when they're done with it, they are able to just move on, and their assigned gender, square one, is not giving them any kind of distress. If, however, throughout the day, you're having distress, you are uncomfortable with your assigned gender, and when you come home from work, for you, feminizing, for you, cross-dressing is a way to get more connected to that part of you, primarily because you are uncomfortable with your assigned gender. And now we're talking about something else, right? Now you're connecting with it because this is an identity you feel more resonant with you. Does it make it clear? This is a very general way to say it. So is it possible to be just cross-dresser and not trans since early childhood? Absolutely. I met a lot of people, worked with a lot of people who cross-dressed in childhood and continued all the way into adulthood, felt very, very comfortable in their assigned gender, and did not experience any distress. A lot of times we have to acknowledge that today's society, today's social media, and today's social media ways of making, so I don't want to say everything, but a lot of people make everything suddenly equals trans. You gender bend, you transgender, you fantasize about yourself being a woman, you're transgender, you cross-dress, you're transgender, you're wearing makeup as a man, you're transgender. And that is not the case. And so I think with all of these messages, it can get really confusing. The key question for you as a viewer you want to ask yourself is, how do I feel about my assigned gender? Again, transgender identity is an identity that arises out of, oftentimes, not for everybody, but for majority of people, out of discomfort and disalignment with assigned gender. But yes, very, very possible to just we need to normalize really cross-dressing, feminizing, gender bending for all gender presentations. We need to normalize cross-dressing for sexual pleasure, having that as a sexual kink. We need to really normalize all of that. And our society is very behind on normalizing a lot of things. Great question. Question number 2 is the question that when I saw this, it blew my mind, because I thought, why did I not make a video about this? Because this is something that I had so many clients struggle with. And it's going to be something that's going to resonate with a lot of you. What are your tips for managing food dysphoria for trans women with big feet? What can you do if you have big feet and passability is your goal? This is a fantastic question, because a lot of trans women, in my experience, do struggle with foot size, do struggle with, I think the biggest part about the foot size, to be honest, that I see my clients struggle with is not so much that they have big feet. It's that when they go out there and they look for footwear, where's the market for big-feeted women? Where's the market for women who have big feet? It's almost like it reaches a particular number, like size 12, and then goes to exceed. Anything after 12 produces this hideous, I'm like such a fashionista, in my opinion, hideous looking flats that a lot of women don't want to wear. And if you love heels, if you love stilettos, I can't blame you for that if you do. I love the look of stilettos, although I cannot wear one because of my foot and my cancer history, but I love the look of them. I mean, they're so powerful, they're so beautiful. It's going to be hard. In my experience, the footwear market for women who have big feet so we either have outlets and clothing stores that specifically create clothing for drag queens, for performers, because they understand that a lot of times drag queens and performers are individuals who identify as men, and they have large feet. And so while there are shoes, beautiful shoes in those outlets, they're also aimed more toward performance side, which means for a lot of people, they're not going to be something that they can daily wear. They're really high heels, they're very extravagant, they're very, just very going out looking shoe. And if you just want something a little bit more subdued, maybe something you can wear to work, it becomes really difficult. I had a client actually who said, I'm stuck between ballerina ugly flats and between this really high stiletto elaborated drag queen shoe. Where's the middle part? Great point. So the market needs to wake up that there's women with big feet, period. Trans women, cis women, women with big feet, period, and we need to fill that market. So it's definitely a challenge there. So to answer your question, what are my tips to manage food dysphoria, especially if passing is your goal, so you're concerned that your feet are going to give you away? Let me give you a few tips. First of all, if passing is your goal and you're overly concerned on your feet, I encourage for you to stop being overly concerned on just one element of yourself. Because passing, in my experience, again and again and again and again, falls down to people being able to create a composite, create almost elements of gender markers that are, it's like musical notes. Each gender marker, clothing, maybe hair, makeup, accessories, shoes, the way you present overall, the way you sound, all of those things that in our brain we tend to assign gender, attribute gender to. Imagine each one of those elements as a musical note. In order to pass, in my experience again and again, you just need enough of them to play a feminine tune. People make a mistake, they hyper-focus on one or other element when it's really a combination of things that plays a tune of femininity, and then the outsiders recognize the tune as being feminine. So I encourage for you not to hyper-focus on just one element, and I really encourage for you to think about combination of things and think about your feet as just one note in the whole musical feminine tune. Now, this is tip number one. Tip number two. Tip number two is, when it comes to physicality and physical attributes, there is a lot a person can do to create a visual, what's the word I'm looking for? In other words, clothing, for example, can either accentuate a body part or makes that particular body part less visible. There's so much one can do with clothing. Just with the makeup, there's so many looks one can do, right? One can just contour their face where their nose looks smaller, their cheeks look more chiseled, just with makeup. With clothing, it's the same thing. If you're big chested, there's things you can do that will make it look more proportioned with the rest of the body. If you feel like you have big shoulders, there's also something you can do. So I would encourage to maybe find YouTubers who talk about style and fashion and talk about all of the things, because that's going to also help you figure out what looks and works best on you. Tip number 3 for this question. It's going to be really, really important for all of you listening to accept things about you that you cannot change. Things that, such as feet size, hand size, things that just naturally part of your DNA. that you just cannot change. Even things you can change, if you absolutely cannot go about changing it because you don't have funds or resources or money, you're going to have to accept it. It's going to be really important. Because spending a lot of energy on things one absolutely cannot change is a losing game. It's going to hurt you, and you're basically putting energy into something that is not going to produce any kind of results. So you might as well withdraw it and focus on gender markers, focusing on your overall, again, since you mentioned passing is a goal for you, focusing on your overall appearance, focusing on figuring out who you are as a person, who you are as a woman. What is your aesthetic? What speaks to you? What appeals to you? That's going to be more important. We make a mistake constantly to do, all of us do, myself included, to do what in psychology we call upward comparison. We compare ourselves to people that have something we desire that is better than what we presume we have. She has smaller feet, she has smaller hands, she has full head of hair, she has beautiful face, she has a great height, she has this, she has that, she's younger, constantly. We never do downward comparison. That's when you recognize that there are people who are in worse positions than you are, or maybe in a worse situation than you are, and from that comparison, be able to cultivate gratitude and compassion for yourself and for what you have, which is so, so important. So acceptance is going to be my tip number 3. It's going to be really, really important. And finally, tip number 4 for this question: how to deal with food dysphoria. Find a way to fall in love with your feet. Yeah, find a way to fall in love with your feet. Get a pedicure in a color you want. Go and have somebody give you foot massage. Give yourself a foot massage. Give yourself a foot soak. Put your feet up and look at them. Have a relationship with this body part. This is also going to be part of your acceptance. Recognize that women come in all different shapes and sizes. Recognize that having big feet is part of you. It's part of so many other women. Recognize that all of us are constantly chasing and aspiring this ridiculously impossible to reach ideal of symmetry, right? I just saw this great video by, she's a makeup person who does amazing kind of a gossip makeup, and she did this great video saying that figure out what your aesthetic is, because everybody looks like Kardashian. It's like this boring same look. Play off on your feet. Maybe even play around with different shoe aesthetic and see what it does to your style, to overall how you feel about yourself. I have a client that she considers her feet to be large, and she struggled to find shoes. And so what she did is she got those cats, like those, what do you call them? They're not exactly sneakers. I think they're called cats. Do you all know what I'm talking about? I'm such not a sneaker person. I wear flip-flops all of the time. Or I wear ugly, bulky Uggs because they're so comfortable. But she wore cats that had this amazing design on them, and it became part of her wardrobe, and that was really hip. So make friends with your feet. This is what we might advise. But this is such a great question. By the way, anybody watching this who has any additional support or maybe you know a great store that has amazing shoes for a bigger foot size, please share it, link it below. The Q&As become so much more enriched when we all collaborate. Great question. Thank you for asking that. Question number 3. What do you think of not coming out to people and letting them figure out your gender as you progress through the transition in baby steps? I assume it's not about safety, so I'm glad you mentioned it, just anxiety inducing to come out. So this has nothing to do with safety. So you're in a safe environment, and instead of coming out, you are, you're doing it in baby steps and you letting people figure this out. This is totally fine. You need to figure out what you need to do, all of you. You need to do what works best for you. Now, while there's nothing wrong with this, I'm going to give you still a little bit of advice. So I think that coming out should be, first of all, not only personal. Second of all, I actually often recommend coming out at a later stage when maybe you've been on hormones for several weeks, especially if the hormones, I know hormones are not for everybody, if hormones are part of transition path, I recommend being on hormones first and foremost for a little bit before coming out. Why? Because when you take hormones, it's going to affirm your identity, and as a result, it's going to make you feel more confident and better about yourself. It's also going to quiet down the noise of gender dysphoria inside of the headspace. When that happens, you have more clear mind, you can see things more clearly, and you feel so much better about yourself that coming out becomes less anxiety provoking, becomes easier to do, becomes more comfortable to do, because you can assert yourself. And if people, especially family members, have a lot of questions, you can say, look, I have been already on hormones and I already can see how much it's benefiting my life. So it makes you feel like you're not just, whipped out your identity and things are not working out for you. Where you can run into problem with not coming out and letting people figure out as you progress through baby steps is sometimes you also don't want to be a passive participant of your life. Think about your life as you writing a story about your life. When we are, especially with people who are really close to us and observe us constantly, when we don't share what's going on this type of important front, then we are basically enabling people to make assumptions about what's going on with us. When people make assumptions, and people seldom will actually ask us directly, hey, what's going on with you? I see you changing. I see you seem to be feminizing more, you're masculinizing more. People will seldom ask that. And they end up just making assumptions about what's going on with you. And they will run on those assumptions, especially if you're in a relationship, your spouse, your partner will start making an assumption. And so I always encourage people to take more active role in their life, to own their life story, it's almost like journalism, right? Somebody reaches out to you for a story and you don't want to be involved. And the journalist says, well, if you don't tell me your story, we're going to tell it for you. And it's going to be from our angle, and it's going to be what we assume. So you might as well be in control of your story. Same kind of thing applies here. So it's fine to do in the beginning. I wouldn't let it go too far, because again, if people start to assume, and they might hold off on asking or talking to you about it or guessing it for too long. So you just don't want this guessing game to go on too long. But other than that, yeah, sure, I think this is totally fine. And it's a great question. Thank you for asking. Question number 4. I was certain I was transmasculine, yet after 3 years of low-dose hormones, I realized I'm non-binary. Since this realization, even areas that brought me immense dysphoria somehow have lessened, as I'm able to integrate aspects of both femininity and masculinity. How can this be? Great question. So how can this be that you were so certain you were transmasculine, you 3 years had low dose of masculinizing hormones, and then you realized you're non-binary? So the reason why, I would guess this, the reason why your dysphoria immensely decreased and lessened is because you realized you're non-binary, right? So it could be that what was causing you a lot of dysphoria, and a lot of times we step into gender identities that become, so they're not always the right identities for us. I shouldn't say a lot of times. Sometimes people do this, and that's all right. This is part of exploring yourself. Gender is incredibly confusing. Gender is overwhelmingly can be very complicated. And so at one time we can be pretty certain that one identity is really our identity. And it's not only until we do things, or maybe until we express ourselves more in that identity, and with time and experiences, do we realize that actually it doesn't really feel quite like me. So it could be for you is that was, as you mentioned, the transmasculine was not really your identity. And so even though you were on low dose hormones, the dysphoria was present because it just didn't really align with you. Once you stepped into alignment, think about like a puzzle clicking into place. Dysphoria decreased. On top of that, you said that it lessened as you were able to integrate aspects of both femininity and masculinity. So this is very interesting to me because it seems like you see non-binary identity, you experience non-binary identity as a combination of feminine and masculine. The way that I see non-binary identity is exclusively neither male or female. It's almost like the exclusivity becomes the backbone of non-binary identity, exclusively neither one or the other. When people integrate more about feminine and masculine, I'm not sure quite what you mean, whether you mean energy. If you mean feminine and masculine energy, first of all, this is amazing because we all need to have a balanced feminine and masculine energy, not to confuse with gender. And it also could be that for you, maybe what you're also implying here is that as a non-binary person, you see non-binary, you experience again non-binary identity as a combination of feminine and masculine, which to me that would be more gender fluid person, but that's just me again. So as you start to have a relationship where you are assimilating components of one end of a spectrum and then the other, you step into this flow that for you probably naturally just feels more comfortable. Your dysphoria, I wouldn't say why did my dysphoria went down once I started to integrate. I would flip the question. I would say is that it's a testament that you needed this integration. Dysphoria is, so there's trans identity, right? A huge umbrella. And then the dysphoria is the symptomatic distress when we start experiencing and feel when we are so disaligned with ourselves. In other words, we are fighting so hard not to acknowledge that we are trans, fighting so hard to resist, fighting so hard to cling on to our assigned gender, which is not for us, that symptomatically our body starts fighting itself. Symptomatically our psyche starts fighting, and it's starting to have all of the symptoms. So dysphoria is like that huge distress signal, right? So think about similarly somebody who's very obese, right? And the body starts giving these distress signals that this is not working out for you. This is not the right state for you. By having high blood pressure, by having developing diabetes, by body aching when you're going up the stairs, by shortening of breath when you're going up the stairs. All of those symptoms is our body's ways to communicate. Our body is constantly in dialogue with us. If you pay attention, it is constantly talking to all of you about so many other things in your life. If you hate what you do for a living and you come home and you need to drink or you need to escape how your job is, and then you feel like shit and you wake up and you're grouchy and you're angry and you don't want to go to your work, this is your mind symptomatically telling you you're not aligned with what you meant to do. Dysphoria is the same thing. It's all it is a symptom that's basically at a point in your life where you are so disaligned and pushing it so far away, it is telling you, wake up. So for you, it could be that what you needed, what actually made the dysphoria go away, is this integrative balance. You needed this balance. And it seems like in the beginning, you went about it in a way that was not conducive for you. You went into transmasculine and started microdosing hormones, which is fine, but you probably didn't feel the best, or maybe something didn't feel right? I'm assuming because you realized you're actually non-binary. And that happens a lot of times. Sometimes we go in one direction only to realize we need to be somewhere in the middle, or we need to go in the other direction. Identity is a lot about exploring who we are. And for a lot of people, it is fixed, means it tends to be stable throughout their lifetime. And for a lot of people, it tends to be more fluid and tends to change over time. So this is why the important thing you need to ask yourself is whether you're experiencing dysphoria now, and if you don't, keep doing what you're doing. Keep doing what you're doing. Clearly integrating both is exactly what your body, your mind, your whole, your overall being needs to feel more holistic, to be more whole, to be rid of the symptomatic distress. Great question. Okay, final question for today. I try to keep it to about 5 questions, about 40-minute mark video, so that it's not too long for all of you. How common and why is it that when a trans person finally accepts themselves, so it goes through major changes like abandoning addictions and getting new good, healthy habits? This is a great question. And I'm so glad you asked, because this question should be a testament for a lot of people just to work on self-acceptance. So why does it happen that when you finally really accept who you are, this huge wave of changes happens in your life? You start taking care of your health. If you were drinking, you stop drinking, or you at least minimize it. If you were doing drugs, you stop doing drugs. You start waking up early. You start working out. You start eating healthy, because you stop fighting yourself. When we step into alignment with who we are, which, by the way, so many of you don't even realize how incredibly exhausting it is to day in and day out put on facade of an identity that doesn't sit well with you. So many of you fight that. So many of you fight accepting that you're something other than your assigned gender. That not only you develop all the symptoms called gender dysphoria, but a lot of you also try to cope with it by, this is why addictions and this is why eating disorders are 2 very, very common things in transgender community. Why? Both have to do with being very masochistic toward a body. But with people with eating disorders in trans communities, they will either become so anorexic because psychologically, subconsciously, they're trying to become invisible to themselves and to the world, or they become binge eaters because if my body is just big and heavy, then it's almost like I, myself, the internal self, doesn't exist. Addictions is the same thing. Addiction is about trying to avoid to in a way where you're really toxically poisoning your body, because that's what alcohol and drugs, all of it, it's, no matter how we look at it, it's poison for the body. And look, I love my glass of wine, but let's be all real. We're drinking poison. That's really what it is. That's what hangover is, detoxing poison out of the body. So a lot of trans people, when they struggle with accepting who they are, and most importantly, struggle to acknowledge that they even have gender dysphoria in the early stages, will go through a lot of masochistic behaviors, will go through so much of just, sometimes I look at what people do and I say, how can you treat yourself like that? How can you treat your body like that? But part of people is that they self-loathe the concept, the idea that they're trans so much. My question is, what do you think is going to happen? If you're going to masochistically attack your body, which is self-harm, by the way, the self-loathing is not going to go away. It's only going to become more extreme. This is why when a person accepts their transgender, and when they most importantly start doing anything about it, even just accepting, even just acknowledging it to themselves, or taking little tiny steps in life to own up to who they are, a lot of the things go away, one, and two, you start feeling freer. You unload all this heavy burden, and you start experiencing this sense of how good it feels not to carry it anymore. And then you also start to experience an element of joy of life, because now you're finally free. You're navigating your life as you are. And guess what happens? The joy is contagious. And guess what happens when you feel joy and happiness? Of course you want to start taking care of your body. Of course you want to look good. Of course you want to be healthy. Of course you don't want to destroy yourself anymore. Happy people don't destroy themselves. Happy, joyful people who are comfortable, who are living a life in alignment with who they are, don't have a need to self-destroy themselves, because they love this. They love their lives. They love who they are. Unhappy people who are repetitively in a cycle of self-loathing, repetitively in a cycle of shame and guilt, repetitively in a cycle of not me, not me, not me, suffer and struggle. So this is why, and I really, really encourage anybody watching who had experienced this, who had experienced your life drastically changing when you accepted who you are, comment below and share that, because so many of you need to hear it. So many of you need to hear this. I see this again and again and again. Again and again and again and again and again. People start living their lives, and suddenly it's like, Dr. Z, I'm taking care of my body for the first time. I'm taking care of my health. Oh my God, I cannot believe this is the first time I don't have high blood pressure. Oh my God, Dr. Z, my migraines are gone. This is why. So the self-harming masochistic behavior doesn't serve anybody. Great questions. I'm so grateful for everybody who submitted their questions. Again, if you want to submit your questions, email is below. All you have to do is email your question or questions, as many as you want. Keep them brief, keep them short. Really excited to restart this Q&A, and there's going to be a regular video from now on Mondays as usually, and on Fridays I will do this Q&A segments. Which I think are going to be, again, very, very valuable to community, very valuable to all of you. So comment below, share your thoughts, share your experiences, and I will see you all next time. Goodbye.